Okay, so I want to go through just a couple quick troubleshooting things with you. So the first thing I want to talk about is, what if your patient has wisdom teeth and you see how they're really covered. This wasn't a great impression of the wisdom teeth, so we've got a lot of gypsum that's kind of covering that area. If we left this gypsum in there, we are not going to get a whitening tray that actually fits in our patient's mouth correctly. So what you'd want to do is you'd want to trim as much of that off. You want to get really close, closer than I did in my demo for trimming. And you may actually end up just trimming half or that entire wisdom tooth off on both sides. So just kind of trim and bring that trim up to those second molars. And I mean, you could, if your wisdom teeth look great, yeah, absolutely leave them on there. But if you've got an issue like this where it's not a great impression of the wisdom tooth, then we're going to go ahead and just either trim as close as we can up to that, or actually just trim the whole thing off so that we can get a good fit with our tray. And that's okay, because these are wisdom teeth. They're way back in the patient's mouth, and they're not a tooth that we really are too concerned about making sure that we whiten them. So you can go ahead and just trim those areas up. Now, what if during your pour up you ended up with some bubbles? Yikes, bubbles. So if we leave those bubbles there, those are pretty big, they're pretty significant. If we leave those there, when that vacuum former sucks down that tray material, it's actually going to vacuum suck it into those holes. And our patient doesn't have holes in their teeth like that. So if our vacuum former forms to this shape, then it's actually not going to fit correctly in our patient's mouth. Does that mean that we need to take a new impression or re-pour this? Not necessarily. What I have found really works well is to actually use some flowable composite to fill those holes in, and that will give us a better result. So what you'll do is you'll actually take some, I'll just do one here. You're going to take flowable composite and you're going to squeeze it and apply it into that space. And basically what you're trying to do is actually build up that area that's missing, and then just cure that with your curing light, okay? And so you would do that to each hole. And it doesn't have to be perfect, but you just want to try to recreate the shape of that missing space where the bubble is, okay? So cure that with a curing light, do it to each hole. These bigger ones are ones you definitely want to pay attention to. Something like this little tiny one, don't worry about those. It's just these kind of bigger, large sized holes that you've got there, okay? And then what happens if you're trimming and your model breaks? So your models, once you get them trimmed down pretty low, they're pretty fragile. If your model breaks in half, you can still use it. I would not recommend just trying to place the pieces together on the vacuum former, because as you see, even when I try to place them together really well, they still kind of have a tendency to move. And when we suck that tray material down on top of this, it's probably going to shift, and then we're not going to get a very good tray. So what you'd want to do is just glue these pieces back together. As long as there's no large pieces missing, if a whole tooth is missing or something like that, we're probably going to have to redo. But if it's a clean break like this, then we're just going to want to get some, if you have super glue, most dental offices have it somewhere in the lab or in the front office, get some super glue on there, let this dry really good so that it'll hold together. Even just a really strong, it doesn't necessarily have to be super glue, some type of a high strength glue so that you can get these pieces held together enough so that you can actually vacuum form a tray over it. That will work. So if you've broken it, make sure it's nice and dry, and then attempt to glue those pieces back together, and that should usually work for you.